Hi, I'm Dr. Richard Chaffoo from CaliforniaHairMD.com. I'd like to welcome you to our presentation today on hair restoration in the 21st century. You know, all of us remember picking up our first iPhone and how this revolutionized technology and the way that we communicate with one another. And I'll submit to you today that we have just as exciting and disruptive technology with robotic hair restoration, which I'd like to share with you today during our presentation. If you have any questions during the presentation, please feel free to ask questions and leave comments below. My introduction into the field of hair restoration began during my plastic and reconstructive surgical fellowship program at Stanford University Medical Center, where I got to meet some really groundbreaking experts in the field of hair restoration and learning a lot about cutting-edge technology, which of course has changed dramatically over the past number of years. The surgical training experience that I obtained was in both cosmetic and reconstructive plastic surgery. And so I feel in a unique position to offer patients various medical and surgical options for hair loss and subsequent hair restoration. My first surgical residency program was in otolaryngology, head and neck surgery. And following that, I spent 1 year as a postgraduate fellow by the American Academy of Facial Plastic and Reconstructive Surgery at Stanford University Medical Center. Following this fellowship, I then completed a plastic and reconstructive surgery residency program. So I'm actually certified by 3 surgical boards: the American Board of Otolaryngology, Head and Neck Surgery, the American Board of Plastic Surgery, and the American Board of Facial, Plastic, and Reconstructive Surgery. In addition, I've recently published a new book aimed at the public to learn more about hair loss. It's called Hair Loss Solutions: The Ultimate Guide to Restoring Your Hairline. It's available online, and feel free to reach out and get that book. It'll give you a lot of information about hair loss written for the consumer. Probably after you've read the book, you'll know more about hair loss and its treatments than many physicians today. Well, this is not how patients view themselves after having had hair restoration, but unfortunately we've all seen people that have had the older methods of plugs, and the hair looked like doll's eyes, and like doll's hair, unfortunately, and the hair now well, this is really how patients don't want to look after hair restoration. This is sort of that doll's hair look or cornrow look, clumps of hair spaced further apart, which look quite unnatural, and obviously patients would prefer to just go bald and shave their heads than to have this kind of appearance. The further thing is that patients are not looking for objectionable scars. The older methods that we utilize, called the FUT, or follicular unit transplantation, was a method where we would take a large segment of scalp out from the back and sides of the head and close that. That would then be divided into hair follicles that were transplanted into areas of balding scalp. The problem with this type of procedure was that it could leave an unpredictable scar that would be difficult to camouflage with a hairstyle. Patients typically had a longer recovery, more pain and more numbness and more tightness to the scalp. Well-designed, well thought out, and well executed hair restoration can literally make a patient look significantly younger. And the reason for that being that we remember that our face is framed by our chin below and our hairline above. And simply by recreating a frontal hairline in a patient in a very natural manner will frame the face and make the patient look much younger than their chronological years, as you can see in this patient of mine. And so let's talk a little bit about this revolutionary technology of hair restoration that's available today, called the ARTAS iX. This is robotic technology that's disruptive to the field, and I believe enhances both the experience of the patient and the ultimate aesthetic outcome that we can achieve. The robot has certain inherent advantages. It's very precise. And so let's talk a little bit about this revolutionary technology of hair restoration that's available today, called the ARTAS iX. This is robotic technology that's disruptive to the field, and I believe enhances both the experience of the patient and the ultimate aesthetic outcome that we can achieve. The robot has certain inherent advantages. It's very precise, it's very accurate, and it's very reproducible. In terms of the ability to harvest grafts, it's probably roughly 30% faster than the best person harvesting a graft. The grafts are high quality grafts, and there is inbuilt AI, artificial intelligence. So the system learns as it goes along more about a patient's scalp to pick up and harvest grafts of the highest quality. It also avoids areas of diminished density or scars that may be there from a prior procedure or from trauma. So it really creates a very random pattern, and creates a more random pattern and is more accurate than the human eye can do. We know that robots have been around in medicine for many years. And any process where you're doing something on a repetitive basis, there is no better methodology for this than the use of robotic technology. So how does this technology work? Well, instead of a handheld punch device that a human operates, the punch is housed within the robotic arm, and it can literally go and harvest these grafts in a very rapid rate, as you can see in this diagram. Another diagram, really just a video showing the ability of the punch to selectively harvest follicles from the scalp. You can see that there's a yellow border, which essentially acts as a GPS that allows a robotic arm to come down and find the site and harvest follicles in a very accurate and precise and reproducible manner. You can see that the robotic arm has multiple joints, and it's able to go within a number of different directions to harvest hairs, almost no matter what direction the hair is angulated in. In addition to the ability of the robot, the iX, to harvest quicker and faster than older models and more accurately, the iX is different from earlier robotic hair restoration devices in two important ways. Number one, it allows for the assistance of site making. Site making is that process where, after harvesting the follicles, the grafts, we're making sites into the balding scalp into which we place the grafts. So now the iX, which is the first one of its generation, can not only harvest the grafts, but also can make sites into which the grafts are placed in the front and the mid-scalp region, and also implant grafts in those areas. So let's have a look at some of the videos of this. You can see here that the surgeon is placing these fiducials, which actually are the GPS, much like we saw when we were harvesting the grafts. And this allows, again, the robotic arm to find the site into which sites are going to be made and the grafts are going to be placed. And you can see in this video, this is simultaneous site making with a needle and placement of the grafts at the same time. There are some advantages to the ability of the robot to do site making, and that is in areas where there is still healthy hairs, which we call terminal hairs. The robot camera is able to visualize healthy human follicles, healthy hairs, and avoid placement of sites and placement of grafts, reducing the potential for injury to good surrounding hairs that are still growing in a patient's scalp. And this is the user interface that I see as a surgeon when the device is operating. The green dots are those that represent where the next follicle will be harvested by the robot, and once that follicle has been harvested, it turns blue, so it blocks the robot from going back and harvesting in an area. So over harvesting, obviously with precautions, is not. And obviously, it was a life-changing experience for her, for me, and for my staff. It was a very gratifying experience to have the privilege of taking care of a patient like this. Another wonderful lady who unfortunately had undergone chemotherapy for serious cancer and did not regrow her hair years after her chemotherapy had been completed. Her hematology oncology physician actually referred her to our practice, and we performed hair restoration for her, and she was thrilled with having hair in areas where it hadn't been able to grow before. Again, very gratifying experience and a privilege as a physician to care for someone like this. So I'd like to thank you for your attention today. It's been a pleasure being with all of you. Please, if you have any questions at all, feel free to ask those to us. You can leave them in the comments. We'll try to get back with you about those. And you're free to visit our website, californiahairmd.com, where there's a lot more information about robotic hair restoration, the other FUE methods that we do, and encourage you to read our book and learn more about hair loss and the options available. It really is revolutionary, I believe, what we have available to offer patients today. Hair restoration is a very nuanced, elegant field where we can create dramatic, significant, yet natural improvements in patients' hair loss and hair restoration in the 21st century. Thanks for joining us, and have a great day.